how did it go about from ideation to official launch?
My pitch was that they allow doctors to offer preventive healthcare services and link it with health insurance.
Preventive healthcare, which is predictive, preemptive, and proactive.
Original idea behind it. I think our viewers got a gist of it. I would like to know a few steps, sir. What were the first initial steps that you took the company from ideation to official launch? And how did you finance the initial phase, like especially when the minimum requirement is of 100 crores? So how did you finance that part, and how did it go about from ideation to official launch?
Yeah, that's these challenges I did face, and I'm trying to find a practical solution to these difficulties. You see, health insurance comes under IRDAI, Insurance Regulatory and Development Authority of India. So it was in 2009 that I uh, sought an appointment with the higher hierarchy of IRDAI in their headquarters in Delhi, and got an appointment to make a presentation to them. That was, I think, in 2008 or 2009. So I went there. I made a presentation to them. Uh, the uh, you see, the my pitch was that they allow doctors to offer preventive healthcare services and link it with health insurance uh, in their individual capacity. What do I mean by that? Uh, to register yourself as a health insurance provider, a company or an entity has to have capital adequacy of 100 crore rupees at least. So less than that much capital adequacy you have to prove first. Now that is a huge amount, and an individual doctor is not expected to have muster up that much resources. You see, so I made a plea to them that as a pilot project, you allow me to sort of as a proof of concept, you allow me to issue health insurance to a limited number of people over a limited geographical territory, for example, National Capital Region of Delhi, and let us see the results. Let me see, let me try and give out my best using the medical knowledge and medical technology. And if the results are good to your satisfaction, we will expand the scope of the services. But for whatever reasons, they did not agree. And I came to know that there are some, there are a lot of internal machinations of the insurance industry because large players wish to retain their control over this lucrative business territory. And whatever. So then I came to the conclusion that I have to set up my own health insurance company. But that much capital, how will I arrange for it? While discussing it with, kept discussing it with insurance experts, and then someone suggested me that why don't you offer health insurance uh, and health assurance. You see, health insurance comes under IRDAI, but you as a professional are allowed to offer health assurance. in which there is no legally binding commitment on my part to pay the hospital bills of the concerned people, but it's only a covenant of good faith between like a doctor-patient relationship or doctor-public relationship, wherein I shall be giving them the best of preventive health care and trying to prevent their hospitalization and them developing any such condition which may require surgery. And in case, but despite all the efforts, if somebody does come down with a disease requiring surgery or hospitalization, ICU admission, then uh, then that is I have this is despite my assurance, but I'm not allowed to pay the hospital bills by the IRDA. But to pay their hospital bills, I should tie up with the health insurance company, which can either indemnify me, or they can have a contractual arrangement with them that I will take care of your clients and provide them preventive health care, and your claim rate will come down. So it will be a mutually win-win situation. So I thought that uh, at the end of the year, we will do the calculation that how much claim rate was reduced statistically.
You see how this is a powerful lesson in this, that how God opens up vistas, new doors for us when problems keep cropping up. New doors keep opening up. The same health insurance companies, they told me that, but there's another revenue sharing opportunity for you, in the sense that those individuals who are seeking health insurance as individuals, they, for a family of 4, are paying premium to the tune of about 80,000, 90,000, 1 lakh rupees, thereabouts per year. But if you can, if they try to come together for the sake of taking health insurance and reducing their premium, IRDA regulations do not permit this. But if so, they have to come together in the form of employment. Only then group health insurance is allowed. But if they come together for health reasons, for example, if you club them together, say 1,000 of them, who are individual shopkeepers, businessmen, and private entities. So when they come to you as health seekers, and you take preventive health care of them, and then when you club them together and seek group health insurance for them, then IRDA will regulations permit this group to come as a group seeking group health insurance at the group health insurance rates. So person A comes to me when he goes to seek the health insurance for a family of 4, his minimum quotation he's getting is 86,000 rupees. But if I can club them together, say 1,000 of them, and seek group health insurance for them, the premium will come down to something like 35,000 rupees. You see?
That's a huge difference.
So, yeah, huge difference. So it's a win-win situation. It's a very attractive proposition for the insurance seeker. It's a very attractive proposition for the health insurance company. And but still, the health insurance company cannot route back this revenue to me, because that will be considered as a kickback and illegal. But the same individual who was paying till yesterday 86,000 rupees, today he is having to pay 35,000 rupees. Or I can, as a health insurance provider, a health preventive healthcare provider, wellness services provider, if I ask him for mere 10,000 rupees, he's not going to mind it. This is what our revenue model is based upon. So then after giving these services to people, we are running it as a pilot project in the National Capital Region. And after providing services to about, say, 10,000 or 15,000, 20,000 people, whatever we can reach out to, and after analyzing the results at the end of 1 year, maybe 2 years, and as a proof of concept, if we can show on paper that a significant difference has been made in their prevention effort, that is, insurance claim rates have significantly come down, this hospitalization and sickness has significantly come down, then we will go to the second stage of the company, which is seeking seed capital for expanding the scope of the proof of concept to 4 or 5 metro cities of India. And the third stage will be to seek venture capital to set up our own health insurance company with adequate capital adequacy. So wherein we'll be able to expand our revenue streams. So this is what it is all about. The ultimate aim is to give a new direction and new shape, not only to health insurance, which is truly a sickness insurance today, but also to the healthcare industry, which is today restricted to hospital industry or sickness care industry, to true healthcare industry. But here also we are facing problems. So, which if you have time, I can tell you in more detail.
Definitely, sir. Please.
All right. So here also we are up against wellness industry. You see, over the past about, because sickness care is calling itself health care. True health care is going unrepresented. So this vacuum is being filled by a newborn industry which has come up over the past 3-4 decades. When I was a undergrad medical student, in those days, we had never heard this word called wellness. But now it has come up as a multi-billion-dollar industry the world over, wellness industry. So there, jacuzzi, spa, whole body massage, this kind of massage, that kind of massage. So all these unscientific but kind of services which the client finds quite ticklish, and they're masquerading as wellness, as preventive healthcare, while contributing nothing towards true prevention. True prevention is that in a predictive, for example, Hexa Preventia or Hexa Preventia. What is the Hexa? It is based upon 6 P. Why do we call it Hexa Preventia? It is based upon 6 Ps. So our wellness services based upon preventive healthcare, which is predictive, preemptive, and proactive, or predictive, proactively preemptive, and personalized, precise, and participative. So it is predictive. We using scientific technology, clinical examination, blood tests, we do the risk stratification and make a prediction. Then we, in a proactive manner, we preempt before the disease becomes symptomatic. We nip the evil in the bud, and then, but do it so in a manner which is precise, not general. That you take this medication take this concoction. It will give you generally improve your health in a precise manner. You measure PSA, monitor it, and thus tackle prostatic carcinoma. You monitor heart health with ECG, echocardiography, calcium scoring, CT calcium scoring, and lipid profile, and do the risk stratification and risk assessment, make a prediction, and uh, ameliorate it in a precise manner with objective, measurable results, and do it in a manner which is participative. We involve the individual like an equal partner in the endeavor, not the doctor giving the orders, sitting on his high throne and expecting the people to obey. Here we involve the client as an equal in a participative manner. So this is what it is all about.
Very insightful and very interesting to hear about it, sir. Definitely a much needed effort in today's life, sir, because considering the amount of sickness that has increased compared to the previous years, and there is an increasing need for preventive health. Definitely, I can understand that the big players and the big corporate hospitals thrive on sickness. To some extent, doctors thrive on sickness too, but it would be a fitting thing to focus more on prevention than cure, because we are also taught initially in our MBBS days that prevention is better than cure. Somehow we have lost